because family members are really the first person to notice changes in patient's condition. They're the first one to tell you, whether it is the home health aide at the bedside, whether it is the actual family member that's there with the patient 24 hours. That's the part y'all have to remember. The family members, their caregivers, a lot of time are there continuously with the patient. We're there once a week. So it is critical that we speak to them because they're really able to tell us how the disease is progressing so that we can adjust the care plan and provide necessary support. So caregivers may report to you physical, emotional, or behavioral changes, some of which may be subtle but highly significant. So if the patient's overall decline, they're able, if they are able to show you the patient's overall decline so that you're able to improve on your documentation and provide better care. So what is it that we need to ask the family? What changes are they noticing? So we ask them, what are some of the changes that you're noticing? Because remember, they're there day to day, they're able to see some of those changes. You ask them, is the patient eating? How's the patient's sleeping pattern? Any new symptoms that they've noticed? Any changes in the patient's behavior or cognitive? Level of engagement with the family or visitors? Response to medication or treatment. Do the pain medication that they're taking still helping them? Have their anxiety gotten worse? And of course, you help them with concerns that they may have. What are they struggling with? You may, at times, if we don't ask those questions, we may not know. They may be stressed out. They may be burnt out. They may be feeling overwhelmed. So this is the time when we start getting in our social workers in, or even our spiritual coordinator, the chaplain. Are there any safety concern in the house? Can the patient still safely be moved in the house? Does the caregiver need extra help? Now, we could have a patient who was an ambulatory patient. Now the patient is bedbound. We need to know, find out, are they able to change the patient in the bed? Something simple. Are they able to change the patient's brief while they're in the bed? You will be surprised how family members do not know when a patient transitions from walking around to being bedbound